So welcome to today's podcast. On today's podcast, we have an excellent guest, Jamie Stice. So Jamie Stice has a fantastic clinic in which she's able to manage patients who have normal labs but don't feel good. This is a very common problem that we have. So I'm very excited about our conversation. We talk about women's health, men's health, how to optimize your hormones, but also more importantly, how can we get down to the root cause of why you feel bad, even though everyone is telling you everything is normal. So I'm glad you're here. So let's stay tuned for our podcast. Jamie.
Hi.
Thank you for coming on our podcast. I appreciate it.
Thanks for having me.
No, it's our pleasure. So we're excited to have you here.
Okay.
For those of us who have not known you or know kind of where you came from, tell us a little bit about yourself.
Okay. So I grew up in a small town about an hour away called Florida.
Yes.
Go for a win.
All right.
Graduated high school there, went to West Texas A&M, went to nursing school, moved back to Lubbock and was an RN for about 10 years.
Yeah.
And during that time got married, had my first kiddos, and then started back to nurse prac school and graduated with my nurse practitioner about 14 years ago now.
So you've been doing this for a while now.
I've been doing it for a while. I've been a nurse since I was coming back from college working at a small rural hospital when I was 18 years old on the night shift, and been in healthcare 25 years. It's crazy. But been a nurse practitioner for about 14 now.
So what made you decide to become a nurse practitioner? Like, what was kind of the trigger for that? What led you to that?
The very first trigger is my brother's a few years younger than I am, and he went back and he's a chiropractor, got his doctorate in chiropractic. He was going to school. I visited him on campus, and I love to learn.
Yeah.
So part of it might have been a little competition at one point, but
Yes.
it just made me think, like, I love nursing. I don't love working night shift and on the weekends.
Yeah.
So how can I further my career, but also maybe have a better schedule for family?
Yeah.
Then I got married and had a baby, so that put that away. But then just went back to nurse prac school just to have a more continuity of care with patients and not just see them and never see them again.
Yeah.
For the education aspect, I love educating people.
Yeah.
And so those were probably the big pushers there.
So what has your journey been like from whenever you started as a nurse practitioner to where you are right now? How has that journey been?
Okay, so my background as a nurse, the last 5 of my career was in the ER and in labor and delivery. So fell in love with women's health. That's what my thesis was on in grad school.
Yeah.
Teenage pregnancy prevent, just all women's health type stuff.
Yeah.
Came out, got out of school, and started at the Texas Tech OB-GYN Pavilion for a while, doing prenatal care. Then moved into high-risk pregnancy, and then had a great offer to work into family practice.
Yeah.
And so in that time frame is where you just start taking care of men and women and people of all ages, and starting to hear the things of, I don't feel good.
Yeah.
But your labs are normal.
Yes.
Right. That whole thing. And not really having an answer for people.
Yeah.
Right. But knowing, if you say you don't feel good, I believe you, but I'm not trained on how to take care of you.
Yeah.
So during that season, I started exploring, figuring things out, go into some hormone trainings, hormone classes, and then just really fell in love with that. And kind of in the middle, like the integrative care, finding root cause, trying to really listen to people. And I practiced that at the family practice clinic where I was at. And you just, in the insurance model, like in what I was doing, it just forces you to see so many patients.
Yes.
And not really be able to spend a lot of time with patients.
You're like a cog in a wheel.
Absolutely.
Yeah.
Right. Like you spend good time with patients and you have 5 waiting for you. And so then it's just a constant battle.
Yeah.
And so when things just started, things sometimes change and you just need something needs to happen, right?
Correct. Yeah.
And at the time, I just needed to start my own practice, which I look back and I think, holy moly, how was I brave enough to do that? What was I thinking?
Well, I think you should be commended for that because that takes a lot of courage and skill. And I think that people don't realize how hard it is to make that decision. So you should be very commended for that.
Thank you. I'm so grateful I did.
Yeah.
I love it. I'm so very proud of what we're building.
Yeah.
So it'll be 3 years coming January, here in a few months, that I've been out on my own. And I do a lot, like probably hormone therapy. If you were to Google me, that's probably what I come up as.
Yeah.
I'm learning more functional, integrative medicine. I tell people all the time, I am thankful for antibiotic. I am thankful for surgeries. I like Botox. All the middle stuff. But man, if we can find that root cause of why do you feel the way you do, right? Then that's where that's my passion. And so
there's a lot of great information you just told us right here. So let's see if we can kind of do a deep dive into some of these things. So I think you mentioned something that's very common that we see, which is frustrating for us as in the clinical field.
Absolutely.
Your labs are normal, but the patient doesn't feel good. So what does that mean? Like, how do we deal with that? Because I don't know how to deal with that.
Yeah, absolutely. And so from our standpoint, we are told what's normal based off of the lab criteria, right? So what's normal is not optimal.
Yeah.
That may be normal for someone who's older or unhealthy. Like, who sets those parameters of the lab? And so looking at things and making sure, like, if a vitamin D is 30, that's been told that it's normal. That's not normal. I mean, it's normal based on the parameters, but that's definitely not optimal. It needs to be at least 80, right? And so just taking a lens and looking at the things that can really make a difference and optimize people's health.
So how do you do that? So let's say that you do have somebody come into your clinic now who says, hey, I've been to so many physicians, doctors, healthcare providers, everything's normal, blood testing, imaging, but I feel terrible. Like, what would be your approach to kind of, when the patient comes to see you, how would you do things different?
So first, I like people to come in and get a big lab panel before, based off of their symptoms. And then when they come back, we do a deep dive. I listen first. And that's not to say that we all don't listen, but sometimes we don't have time to listen.
You're right.
And so that is the very first thing is, who are you? Tell me not just how you feel, but how long have you felt? Have there been any traumas recently? Because if there's a trauma, can be as little as changing jobs or our kids going to college, right? Those are traumas, right? But it can be really big traumas, and that can definitely affect like all kinds of things. So finding out who they are, where they've come from, what's going on, then taking a deep dive into the lab work and trying to find how can we optimize hormone levels, vitamin levels, then starting to dig down into how are you sleeping? Are you going to the bathroom every day? Like, what are your stress levels like? What is your home life like? Not that I'm a counselor, but if we don't address the whole person, we're missing a lot of it.
I think you're right, because, unfortunately, medicine tends to be very siloed, but also very, like we mentioned before, just a cog in a wheel.
Absolutely.
You have to address the acute problem, and everything else we can wait till later on. We can't go into the whole person and heal them.
Absolutely.
And so you've been able to do that. How is that? How have you been able to do that? And B, what has been your experience like in having a different practice than what you were than what you had before?
So the how, I'm still learning. I have to be honest. Being in a cash pay practice, it is difficult. I want to be a respecter of people's money. Right? Because your time and your money are things you're never going to get back. Right? So trying to figure out a good amount of time to spend with people to actually get to that depth that you need. But then also be mindful of the budget. So that trying to find the time frame is important from the provider standpoint. It is the most gratifying thing. The more you get to know people, the more it helps the depth there. You can figure out where to really like start to hone in on. And so that part's very gratifying and very fulfilling as a provider. But then patients, they light up. They enjoy being seen, being heard, right? They enjoy that. I remember that their husband's having surgery, or that they had knee replacement, or whatever. And so being able to like really form a relationship, I always tried before, because I feel like that's important no matter where we're at in life. But in healthcare, I think that's just something I really value. So doing this type of care is just really rewarding.
I mean, it sounds very fulfilling.
It's very fulfilling.
I mean, it's why we went into medicine.
Absolutely.
I mean, literally, it's the reason why we all go into medicine,
100%.
to help people like that.
Absolutely.
So going back to the scenario, if I was a patient coming to see you, typically how long of a time frame, how long do you spend with patients?
Well, that's part of the financial. I really probably need to spend an hour to an hour and a half. Right now I'm set up in 30-minute slots. A lot of my new patients, I'm running late and running about 45 minutes. And that's with having the labs before. So that usually the follow-ups I can get taken care of in about a 30-minute session. But I'm looking to add some deeper dive options for longer appointment times and stuff like that.
So we hear a lot of kind of hormone therapy out there, and there's a lot of information out there.
Absolutely.
Some of it is very confusing to not only us in the medical field, but
Absolutely.
I can imagine patients who hear this as well. So
Absolutely.
what are some things you've kind of seen, noticed, or how do you kind of approach patients whenever you really think the hormones may be an issue?
Okay. So for one, our education, and it still is, it's based off of the Women's Health Initiative trial. And that really has geared where hormone therapy has been focused on for so long. Like, hormones are bad. Maybe use an SSRI, like an antidepressant instead. Maybe use hormone therapy for as little amount of time and then take them off of it, right? So our education has not been founded greatly. Those studies have recently been, I don't know if debunked is the right word.
Yeah, but there's been a lot of questioning about some of the assumptions we had from before.
100%. And ultimately, those trials, they pointed towards, those trials were based off of synthetic progestins, not bioidentical hormone replacement therapy. They also were on women who were starting, like they were already menopausal, already around the age of 65 or so. And at that point, they may have already had cardiovascular disease. And so it's not the best of trials to base it off of. So for one, trying to see where the patient, if their comfort level is, I'm great with hormones, fix me, versus, I think hormones might cause cancer. So trying to feel out the patient and see.
You're right, that spectrum is so out there.
It's so, absolutely. Or, hey, my best friend had breast cancer and we think it's from estrogen. So you have to educate the patient, see where they're from, like where they're at and where their comfort level is in regards to hormones. And then from there, you just start talking about all the benefits that could potentially happen when we optimize somebody's hormones.
So you know, a lot of people think that hormone problems or deficiencies are just in women. Is that true?
That is not the truth at all.
Okay.
Men become deficient in hormones as well. Like your testosterone level, not yours specifically, but your testosterone level, it's a certain level when we're younger, and then with age and stress and all life, it starts to deplete. And so when we can replenish that testosterone level, it helps with just overall well-being, sleep quality, anxiety, vitality, workout results in the gym, muscle breakdown. It helps build muscles. So it's good for men as well.
So if a patient is interested in hormone therapy, either a man or a woman, what would be some of the things that they would be symptoms they would kind of be like, this may be a trigger that maybe something else is going on, and even though all the labs are normal, like what would they be?
That's a great question. So specifically for women, and some of these definitely they mix with men and women, but specifically for women, in perimenopause, which really can start late 30s, but on average it's in the 40s. Perimenopause, you start to see increased anxiety, sleep quality is decreased, brain fog, decreased libido is definitely a thing, vaginal dryness. I see sometimes some gut health issues definitely occur because when estrogen depletes, that's actually a pro-inflammatory, inflammatory state. And so when women don't have estrogen, inflame works with the gut as well. And so I see that with men, decreased sleep quality, erectile dysfunction, decreased libido, not having the results they want in the gym. Those types of things are things that I see.
So that would be at least kind of a quote unquote symptomatology that patients may notice, hey, something's off in there.
Absolutely.
Okay.
Absolutely.
And so they come to see you, you get the blood work ahead of time, which I think is very, very, very smart. So why do you do that? It's very unique.
Well, for one, it helps with time. Like I'm not bringing you back next week. Because when patients want to get fixed, they want to get fixed.
It's a pain in the butt to keep on waiting.
Absolutely. And so I like them to have that blood work so we can set a plan and I'm sending prescriptions or we're initiating something right there. So
smart.
I like that. Also, it just is a buy-in, right? If patients want to come in and work, like you need to have labs. I'm not going to just prescribe something without having your baseline. So it's very important, like hormones, it's more important to me how you feel than a number on the page. But I use the numbers on the page and your symptoms to help with my dosing. So it's definitely a both and.
So, I'm sure you've had patients who were either not feeling good and got better or were on medications that you were able to get them off. Tell us some of these stories because, unfortunately, a lot in medicine now, we just tend to pill people all the time, and they may do the right thing.
Right?
It's not.
Right. And so traditional healthcare gets the bad rep for that, but we just want to help people. And if you have 10 minutes to spend with somebody and they're not sleeping, well, here's a pill. You just don't have time. So I had I think she was 52, 53 years old.
Yeah.
Recently menopausal.
Yeah.
Came in. She was on an SSRI.
Yeah.
And she was on a sleeping pill.
Yeah.
And an as-needed Xanax.
Yeah.
Just for anxiety.
Yeah, yeah.
She comes in. Her hormones are like completely depleted.
Yeah.
Vitamin levels depleted. She was not sleeping well.
Yeah.
So we got her on, after doing the blood work and everything, got her on a good regimen of progesterone, which is nature's Xanax, right? Like it's just our body's natural, helps us sleep well, helps with brain, GABA activity in the brain. So got her on progesterone, estrogen, testosterone, got her vitamins optimized. I brought her back in 3 months, walk in the room, and she cries and wraps me up and says, I am off all. Now, I did not tell her to cold turkey her.
Right.
I told her when I saw her back, if she was feeling good, we could start tapering off. She cold turkeyed all of her meds.
Yeah.
And she's only on bioidentical hormones. And she said, nobody's ever listened to me like this before. Thank you. I've never. She found herself again.
Yeah.
And so, again, it just makes you feel really good.
Yeah.
Honestly, I'm just passionate about something that makes a difference. Like, I don't. It's just really good. It's really gratifying.
So what that actually is, we've heard a lot of stories like that from a lot of patients. What are some of the, I guess, side effects or some of the things that, hey, hormone therapy may not be the best for you, or some problems? Because not everything can be just
100%. Great question. So for someone who has had a history of breast cancer, ovarian cancer, uterine cancer, or for a male who's had prostate cancer, we would definitely do a good health history, and then the testosterone I would be good with doing, but the estrogen we may be cautious with.
And tell me why. What is the concern that you're kind of having with
My
that?
biggest concern is based off of the WHI trials.
Yeah.
And even though the newer studies that are coming out are showing it is actually protective for the breast, testosterone is protective for the prostate.
Yeah.
If I was to stand in a jury of my peers, like if anything bad were to happen, only maybe 2 out of 20 would know the new research. And so, you know, the whole what would any prudent provider do, I would never want to cause harm, and I never intentionally would.
Correct.
But what we've been trained may still be conceived as or perceived as harmful.
Yeah, and that makes sense.
That's my hesitation with it. But now, men who've had prostate cancer, if they've had their test of cure, the urologist will give them clearance to have testosterone therapy. Yeah. And the same with breast cancer. If they are complete with their treatment and feeling horrible, we can absolutely do some testosterone. And that in itself helps women a lot, feel a lot better.
So one of the arguments against hormone therapy that I've heard from other colleagues in the medical establishment is that, as we naturally age, this is kind of the natural process. This is how we're supposed to be living, and so why don't we just embrace, kind of being quote unquote old?
Absolutely. Well, my question was, why would we have to?
Yeah.
I mean, I want to go snow skiing when I'm 90 years old. My goal is to beat my grandchildren down the slope. Yeah. And having testosterone on board and hormones will keep my bones strong, my muscles strong, my brain strong. Yeah. I want to work until I don't want to work anymore. Yeah. Right? So I also think that aging, as we see aging right now, it is a result of our environment, our food, our stress, our lack of sleep. And so I don't think we age the way we were intended to age. Yes. Right? Yeah. There were women having babies in their 600s and long time ago. Yeah. Like, were women supposed to go through menopause at 42? Yeah. I don't think so. Yeah. But we do. Yeah. And I think it's a result of just years and years and years, like decades of just the way we live. Yeah. So I don't like when people come in and say, I know this is just a part of aging. Yeah. Because I want you to age the way you want to age. Yeah. And if you want to chase great grandchildren, then let's hope you feel better and live life to the fullest. I agree. Right? And I'd much rather put you on some testosterone than put you on some Prozac because you're depressed that your body doesn't work the way it used to. That makes sense. Yeah. So then the other question then, kind of piggybacking off that, is why shouldn't everyone be on some sort of replacement therapy? Because it seems like we're all going to get to the point in time where something's going to break down. So should we all maybe consider this, or kind of what are your thoughts on that? I feel like if we'd secretly put testosterone in the water, we'd all be nicer. The whole world would be nicer. I think most people could consider be a candidate, and that's a pretty broad statement. Yeah, of course. I think hormone therapy is amazing. Yeah. Now, amazing, but we also have to address, how are you sleeping? Correct. What is your stress level? Are you moving your body? Are you having regular bowel? All the things that make us healthy, right? Yes. Hormones is just a very, very integral part of all of it.
Yes. That's actually, I think, an excellent point you just made, because you're right. It's one part of the whole picture.
Absolutely.
And so in your practice, how do you address kind of the rest of the picture then?
Yes. So that is continuing to develop as well as we continue to branch out. But we have 5 pillars of health: eat well, sleep well, move well, align well, which is having good community and relationships, and connect well, which is connecting with people, with your spiritual, all the things, because it's whole body, mind, and spirit health. Yeah. And so I just try to touch base on that, because you are not just a person coming in with symptoms.
Right.
You're a person who has relationships outside of here. And so I always try to incorporate those things in. Definitely make sure that they know that I'm not just treating your hormones. Like, you have to sleep well. You have to drink enough water. You have to move your body.
Yeah.
Otherwise it's not going to work.
What are some?
It's going to work.
But
not as much.
Exactly. You're not getting the full benefit of what you need.
Absolutely, yes.
So what are some of the common things you've seen your patients struggle with when it comes to some of those other things? What are some common mistakes that they make? Or what have you seen, like, hey, you should be doing something differently in any of those other 5 pillars? Like, what have you noticed?
Yeah. I take care of a lot of perimenopausal and menopausal women.
Yeah.
And men that are high achievers. I think just in the 40s, 50s range, I think that's probably the primary patient focus that I have.
Yeah.
And people don't sleep.
Yeah.
Man, they're so stressed.
Yes.
We're so like, not strung out, but like just so stretched thin. Our nervous system is firing so fast. Yeah. If we just sleep better, right? Our cortisol decreases. And then when your cortisol, it's just so basic, but we forget about it, right? Myself included.
Oh yeah, absolutely, all of us.
I mean, as a business owner, I've aged more than last year.
I know.
Right? So, but sleeping is huge, and it's attainable. Like, we can make that change tonight if we're intentional about it. Eating well, I think with busyness, it's easy just to go through the drive-through rather than do a little bit of meal prep, or at least go spend a little bit more at a healthier option, or you know what I mean?
Yeah.
So I think those 2 things are very common. I think what a lot of people don't realize is how important, like, trauma, emotions, stress level, all of those things are huge. Yeah. Like, we have to deal with our crap, or your crap's going to deal with you, right? I mean,
actually,
no pun intended.
That's actually really good. Wow. Yeah.
But it's the truth. Yeah. We have to pull that stuff out. And again, I'm not a counselor, but if that starts to come out, then I refer people to that stuff so they can deal with that.
Yeah. So there are a lot of different ways people can get hormone therapy: pellets, gels, creams, whatever.
Yes.
How do you pick which one that you're going to recommend? And is there a particular formulary that you would recommend or that you use?
Great question. I personally like hormone pellets for myself.
Yeah.
But that's also the way I started my training.
Yeah.
And it was the first modality that really offered really great education on, hey, your patient feels bad, but their labs are normal. So it gives you something to grasp onto. Yeah. But through the years, pellets are not for everybody. Yeah. I love them for the right person. Yeah. And so with that, you can do hormone pellets for men and women. I do topical creams for men and women. I do oral troches, which is a dissolvable tablet for women. I haven't done oral for men. That's still not quite sure about that, but the oral dissolves through the mucosa, and so it's good. And then I also do testosterone injections. And so my conversation with people is ultimately like pros and cons of each one. Cost definitely plays a factor. Pellets are typically a little more expensive up front, but they last for 3 to 4 months in women and for 6 in men, but it's a bigger chunk up front. Is it better for your lifestyle? If you have small babies at home or a pet that sleeps under the covers, I'm not going to put you on topical creams because there's the risk of transfer. Are people afraid of needles, right? If they are, I'm not going to teach you how to do an injection at home once or twice a week. So it really just depends on budget, how compliant they're going to be, and then what kind of risk factors they may have at home.
Yeah. Okay. So kind of going along that same question, and now I'm curious about this question. So if you have somebody coming in who may be worried about the symptoms of deficiencies, their testosterone is, let's say, normalish for kind of their age, like 800 or so for something in their 50s or something, but they still feel bad. How do you kind of think about that in terms of, is this person the right candidate or not? Because I'm sure there are plenty of people out there who do get blood checked and their testosterone is normal, but they still feel bad. But their doctor traditionally will say, you're not a candidate for this.
Absolutely.
How do you approach those patients?
Well, so for one, in primary care, we're taught that a normal testosterone for a man is 250 to 800, 250 to 1,000, depending on the lab. I was taught if your level is 255, but you have symptoms of low testosterone, you're normal, right? And that, which for one, that's not optimal, right? So when you have somebody who comes in and let's say like your example of a 55-year-old with a testosterone level of 800, for one, that's super rare. Most men that I draw are around 300, and most about 600. So most men are running a little lower. But are they having their total and free testosterone drawn? Are they also having their sex hormone binding globulin drawn? Are they having a fasting insulin level drawn? Right, so insulin resistance can definitely play a part in all of this. It can drive up our need. So maybe your total is great, but if your free is horrible, you don't have any, your body does not have, it is not readily available to be utilized. So they still may need replacement. And so, but let's say everything is perfect on the labs. Like I have a guy that's 55 with a testosterone that's 800. Their free testosterone's optimized. They're not insulin resistant. They're in the gym every day, but they feel horrible. Their sleep is horrible. Well, that person's normal. It may have been 1,500 20 years ago or 10 years ago. And so then my conversation is, hey, this is what the lab says is normal. Here are your symptoms. Let's be conservative and start you just on a little and see how you do. Because more is not always better. More testosterone is going to make cause some erectile dysfunction, or it may cause some ear. So you can when I say overdose, like you're not going to overdose, but more is not always better. And so finding that sweet spot where that patient actually feels better, while you're educating them that we're actually practicing off label here. But we're practicing to optimize your health.
Exactly right. Each individual person, not just a lab number that's kind of out there.
Absolutely.
Okay,
that's how I would address that.
That makes sense. And then once you're on hormone replacement therapy, are you able, is that a lifelong therapy or do patients get off? How does that work?
It's uncomfortable because I don't love telling you you're going to be on something for the rest of your life. You can stop it at any time. But once you do, you lose the benefits of it. And so that's just the conversation. If you feel great, then you can safely continue this for the rest of your life if you so choose. Right? It's not something that I tell a 65-year-old woman, okay, it's time to take your estrogen away. Right? I don't do that. Or if you're 70, sorry, you can't do hormone pellets anymore. Or testosterone shots. So it's I guess a case by case basis.
That makes sense. That makes sense. Okay, sounds good. What kind of patients do you want?
I like any patient that gets told your labs are normal. And you feel horrible. I don't care if you're 16 years old, if you're 85 years old. I love that. Like, let's just dig a little bit deeper.
Tell me why. I'm really curious about that because that's a very common question or a scenario where you're 16, you're 20, you're 50, you're 65. Blood tests, imaging, everything is normal.
Absolutely.
Why do you have a passion for those patients? Because those are the most difficult patients to handle in traditional medicine. It's because we just can't help them.
Absolutely.
Like, why do you like them?
Because when you can finally find something that makes a difference in those people's lives, it really makes a difference. Like when somebody comes back and says, I am sleeping better, I like my husband again, or I'm not yelling at my kids, or I'm not having migraines 5 times a week anymore. It's just so rewarding, right? And I've put so many teenagers on birth control. I'm not saying birth control, like I'm thankful for birth control, but birth control should never be used as a period regulator. What are their ferritin levels? What's their progesterone level? Like there's just so many things we can do. We can do better. We can do so much better when we just have a little bit of time. Right? It's not necessarily easy, but it's not hard either. Right? It just takes time and doing things just a little bit different than what we're taught. Which
So how do you feel like you do things differently in that sense? Because you have the time, obviously. You're still 30 minutes to an hour. You do the labs ahead of time.
Right.
How are you able to break the model that we can't fix in traditional healthcare?
Absolutely. Well, and I think one, I don't see as many patients all day long. And so just not having the time constraint is huge. Continuing education, right? So it's kind of lonely being in these places because integrative and functional medicine might maybe think a little bit different. So if you're in a room full of your peers, it's a little lonely, right? So I definitely have to seek out good education and being around like-minded people. Also, I never want to do anything. I never want to ignore the obvious. Like I'm always like, if somebody, like I was mentioning earlier, if somebody comes in with rectal bleeding, guess what? I'm sending them to you first. There is no functional integrative medicine that needs to fix this, right? We need to rule out the bad stuff first, and then if everything's good, then let me dig into the hormonal aspect, the ferritin levels, like what are their progesterone levels? What's their GI map look like? Like what's the bacterial makeup of their gut? I feel like I want to learn constantly. I feel like I need to read constantly. I need to go to conferences. I need to read. It's just constant. There's just like, what are you going to do with all this knowledge? But also, I need to get more. It's just that constant flow. And so trying to learn more as I go in regards to functional medicine, making sure that, like some days I think maybe it is best to put this patient on an SSRI or some anxiety medication, but just allowing, like that's not my first thought, right? And it's so basic, like if somebody comes in family practice and they have a cold or strep throat, like if they have strep, they need an antibiotic. But if you have a cold, it's just so easy to say, here's an antibiotic, see you later, and I'm out in 5 minutes. It takes more time to say, oh, this is probably viral. Here's how we can optimize your immune system. And then if it's not better in 10 days, give me a call, I'll send you an antibiotic. Right? So just practicing just a little bit different in that regards.
What do you feel like is some of the more common reasons why people just don't feel good? Is it those things we talked about, the sleep, the hormones, or what do you feel like is kind of the underlying cause? It seems more prevalent, I feel like, recently than maybe what we've seen before, or maybe more aware. I'm not quite sure.
I think we're more aware. I think there's more like TikTok and social media and books that makes people think like, oh, wow, that's how I feel, and I just thought it was normal, right? So the awareness I think is huge. I really feel like our diet and our stress levels are huge. Like food, what we eat.
Yeah, we are what we eat.
We are what we eat.
Absolutely, you're right. What are some of the common mistakes in terms of eating then? Like what have you noticed, or what are kind of your thoughts on that?
I feel like kind of my stance in the clinic, and this is not backed by, it's just where I feel comfortable. If you know who its mama was, and you know where it grew, and it has limited ingredients, probably pretty good. Like those are good go foods, right?
Yes.
Now some people may have some sensitivities in regards to that, but as a whole, I think those are pretty good. I also used to be on a big gluten-free kick as a whole for like people that have Hashimoto's and leaky gut and stuff. But also, I don't think it's necessarily a gluten sensitivity. Like, what percentage of people actually have celiac? Like very, very rare.
It's pretty small.
But so many people actually have gluten sensitivity.
Yes, they do.
Because of the way our food, the way it's processed.
Yes, exactly.
And so I've seen many people who can tolerate fresh milled grains, right? And that's pretty incredible but that's also a hard learning curve to start learning to mill your own grain and bake in your own home. And but people who do that, they have a lot of, it's good for the gut. It's really good.
Absolutely. It's one of the more healthier things you can do for your gut, better than eating any other stuff you're getting outside. So Jamie, if someone is interested in seeing you, wanting to really understand what's going on, if their labs are normal but they feel bad, how can they find you?
Probably the easiest way, they can go to my website, and there's actually, our phone number is listed there, but you can actually book a consultation just directly from the website. And our website's www.sozohealthlbk.com. So that would probably be the very best. We do have social media, but it's not super up and running, but you can contact us through there. But phone number, website is the best.
And if they are able to do that, they're able to get in touch with you and your clinic and schedule an appointment.
Yes, absolutely.
Fantastic. Well, Jamie, thank you for having us on. It was a great talk, and I appreciate your time.
I appreciate you. Thanks for having me.
Absolutely.
I really, like for reals, appreciate it. It was
absolutely.
fun.